The stories shared on It Takes Balls are unique to the individual sharing. Always speak with your trusted medical provider for treatment options specific to you. Welcome back to It Takes Balls, presented by Testicular Cancer Awareness Foundation. Today's guest is a geologist, and it's safe to say that he had a rocky road. Today I'm joined by Alex Tothill-Brown. Alex, thanks so much for being here.
Glad to be here, Stephen.
So you are up in Canada. So before we get into your testicular cancer story, I know that the majority of our listeners are in the U.S. and there's a decent portion in Canada, but are you able to speak to like the healthcare system in Canada?
Beyond my own experience, not a whole lot, because my experience with cancer was probably the very first major medical problem I've ever had. And obviously it's a massive one. So just from my own experience, I would say that it does work effectively, so long as you have, I would say, an advocate within the healthcare system, which fortunately enough, I had two. I had one for my mother. She was on top of everything. She was with me the entire way. She insisted on being with me the entire way, and basically acted as more or less the brains in my entire experience there, because cancer affects your mental state significantly. So that was one of the reasons why she wanted to be with me. But secondly, I was extremely fortunate enough to be diagnosed by one of testicular cancer's experts in the field. Globally recognized expert, Dr. Christian Kohlmensberger. Some of your listeners might know that name. So he was a doctor at the BC Cancer Agency, where I was receiving treatment.
Yeah, that's amazing.
So I was almost railroaded through the entire thing, mostly due to his advocacy, but also the state that I was in at the time.
Yeah, that's awesome that you had like those two resources in the doctor and your mom, and definitely shout out to moms, because my mom was a big help through mine as well. Mm-hmm. So take me through like when you first were diagnosed. I read in your story that you had collapsed in class, but you had noticed something wrong before that.
Yeah. So do I want to start from the very first? When I first recognized that this could be cancer?
Yes.
Okay. So diagnosis was in January. Sorry, this is my cat. She does love to be in the center of attention, so she'll be here. So January 2014 was the diagnosis, but the first time I would have noticed something was wrong would have been the previous summer. So I think it was around April of 2013. I was still a university student at this time, so I was in the market to buy a bicycle in order to get around campus. So BC, very big on personal transportation like bicycles. So all the buses have racks in the front, so lots of students will bring their bikes to campus. So I went downtown to get a bicycle. Perfectly fine. Went and bought one. Any of your listeners in BC will know Stanley Park and the bike shop next to it. So I walk my bike out of the store, take it to the top of a hill, think to myself, I may not have a helmet with me, but I'm just going to get on it and ride down the hill to the bus stop, take the bus back to my apartment. I get off the bike and I realize that I'm feeling something tender, exactly where you'd expect. Mm-hmm. And so, of course, I'm not going to check anything while I'm out there in public. So I get home, check out the area, and sure enough, I find a noticeably large mass there. Not quite the size that it eventually reached, but it was definitely abnormal at the time. And at that point, I just kind of had to make the decision of whether or not I should do anything about this. And unfortunately, at the time, I rationalized it to myself that it was just something else. And it wasn't until November, probably October through December of 2013 that the symptoms just started to pile up.
What were those other symptoms that you were feeling prior to your collapse in class?
So in October, I think, near the end of the year, I made the decision to try to get back into martial art that I've been practicing for a number of years. And during one of their practice, during most of the practices throughout October, I was out of breath significantly. noticeably faster than anyone else. Um, Looking back on it, I'd say that that was another symptom, just given the metastasis that had deposited in my lungs. What else? Yeah, and then probably the most obvious one, right around Christmas time, I had returned back home to Ontario to be with my parents, and I started coughing up blood right on the first New Year's Day, actually. Pretty sure. Um, for that symptom, the way I rationalized that was when I was growing up, I had always had very heavy nosebleeds as a kid. Just the wall, um, the coating in my lung, sorry, not my lungs, in my nose, was always very thin, and they would just naturally occur with enough time and with the dry air. So I thought that there was some blood in my airway and was coming back out when I was coughing. But again, looking back on that, it was a rather silly assumption.
So when these things were happening, had you ever heard of testicular cancer before, or this was all just you were rationalizing these things just based on your own experience with it?
Well, being in science anyway, and growing up being taught to think about these sort of things, I understand that cancer is a affliction of the cells, which means that naturally any cells in the body can have cancer masses grow in them. So yeah, in my mind, testicular cancer certainly was a possibility. And actually, back in that previous summer when I noticed the tumor for the first time, I distinctly remember in my head thinking for probably about half an hour or so, this could potentially be cancer. It was something in my thoughts at the time.
Gotcha. So then the big day that I read about in your submission and in your mom's post about it is when you collapsed in front of your professor. So you might not remember passing out, but what can you tell me about that day?
Well, my mother may have been dramatizing it just a little bit, but when she says collapsed, mostly it was that I was just in very bad shape that particular morning. So I woke up for classes and I distinctly remember a very sharp pain. I believe it was in my side. So this is the right side of my stomach, sort of right around the middle. At that point, I thought that I can't quite remember why I thought this might have been the cause, but I'd convinced myself that I just needed to go see a chiropractor. I'm not, at this point, I can't quite remember why I thought that. So I was a bit delusional. I would say I wasn't thinking straight. So I got to campus and spent the first class of the day very early in the morning. And my professor comes up to me after class and says, "I've been watching you for the last hour and a half, and you definitely look unwell." So I think at that point I stood up and probably almost fell over. And at that point, he realized that, yeah, you're not doing well. Let's just take you outside, take you to the washroom to clean you up and see what's going on. I think, yeah, in the bathroom, maybe I might have fallen over, and then he came in after me. And at that point, he decided he would take me to the hospital, to our on campus hospital.
And you're how far from home at this point? Because you said you're in university. So were you close to home, far from home?
Okay, so I live in British Columbia on the West Coast, but I was born and grew up in Ontario, which is, you live on the East Coast, right? So yes. In which state?
Virginia.
Virginia. Ontario would be roughly north of you. Are you closer to the coast?
Yes. Right on the coast.
So maybe north west of you, roughly. It's near it's north of the Great Lakes, basically. And then I spent some time abroad just after high school, between high school and university. Basically, I took a gap year, and then I was accepted to a university in British Columbia, and I spent approximately 5 years there. And it was right during my last year of university that this happened. So I was in one of my last classes for my degree, and that professor was actually later on, after my treatment, was the same professor that I did a some research with in order to complete my the credits that I needed for my degree.
Gotcha. So technically, I guess at this point in your life, I mean, you are an adult, but like you're far from home. And when you're going through this and you're not with your parents, like what is that like for you?
What I was feeling at the time, I guess I didn't really have much of an opportunity to think about that. I was at the time of the diagnosis. Let me just go a little farther ahead. So my professor takes me to the campus hospital. I sit in the waiting room for approximately 4 hours. As you know, Canada does have a socialized healthcare system, which I would say in my case, it worked absolutely flawlessly. It does not work for every case. So you need to keep that in mind. But also another caveat to that is you do wait quite a bit. So thankfully, in my case, I wasn't quite so in such a critical condition that I couldn't wait just a bit longer. So I took about 5 hours in the waiting room to see a doctor. So we did a blood test, and the results from that came out back in about half an hour, so fairly quickly. And then I actually had a doctor come out to the waiting room to see me in person. He took me aside, and he just asked me a couple of questions. And then finally, he sort of lowered his voice and then discreetly asked, have you recently noticed anything in your groin area that shouldn't be there? So he immediately pinpointed what was wrong. At that point, I just basically all the denialism that I'd had up until this point just kind of went away, and I just had to admit to him that yes, this is what happened. And I think it was actually out there in the waiting room. I sat up on this table and just unzipped my pants and very discreetly showed him.
Oh, wow.
But to answer your question, at that point, once I've reached that point, it was just fear. So I wasn't necessarily thinking of my parents. I immediately texted them. The first thing we did was an ultrasound, and I distinctly remember while waiting for the ultrasound, at this point I didn't have a phone. I'd never really been too focused on having a cell phone during university, so I mostly dealt with any device that could connect to the internet. And I distinctly remember texting my mother and having such a hard time typing out anything because my hands were shaking. Mm-hmm. So at that point, fear was once all of the other possibilities of what I thought this could be immediately went away. That's when the fear basically just set in.
So then what were the next steps? Because I know your journey was kind of a different order than most based on the metastasis. So if you can jump into that a little bit.
Yeah. So when you say different order than most, it seems to be a difference in how cancer is handled. Okay. Maybe I'm not quite getting this right. You know me through my mother, right? She's been very active in the groups that you were in. Since my treatment, I've never really been too involved in this. I'd like to help out people wherever they can, but I've just never had the opportunity to. I've never met anyone else who had this particular kind of cancer, and I'm not really seeking them out, but I'd like to in the future. But my mother knows far more about this. She tells me that in the U.S. they like to go immediately into either surgery as the orchiectomy to take out the tumor. Mm-hmm. Christian Kohlensberger, he does things his own way, more or less. Being a globally recognized leader in this cancer, he has an extreme amount of sway in how he does things, and let's jump back a little bit because this requires some explanation. So from the ultrasound at the campus, the university hospital, I was transferred to our city's central hospital for an initial examination and diagnosis from them. So I spent the evening there. It was getting later into the day and into the night. So we do blood tests, we do CT scans. And once I'm finished in the emergency room, they get me up to a room. I finally get a little bit of chance to sleep. And about 7 a.m. the next day, I get visited by two resident surgeons, and they bring in some paperwork, and they want to basically proceed how you might, the way that you said it's generally proceed, which would be the orchiectomy first. They wanted to get the tumor out. So I had no idea what was going on. And at this point, I sort of resolved myself to just go with what the experts were telling me. So I didn't want to have surgery, but I knew that this was far too serious to say no. And so I signed the paperwork. I listened to their explanation saying they want to get this tumor out. So I spent the next couple of hours by myself, just waiting for the surgery that was, I think, supposed to take place that day. And then I get a visit from Christian Kohlmensberger in person. And he tells me that, no, we are not doing the surgery. We are going to take you to the adjoining building, which is the cancer agency for that hospital is in a separate building. So he pulls me out of the general hospital and into the cancer agency in order to start chemotherapy. My understanding of that was he personally does not agree with the process of doing an orchiectomy first. I believe it was because my condition was so far gone. Mm-hmm. Just a moment. So my diagnosis by Christian Kohlmensberger was a poor risk non-seminomatous germ cell tumor with extensive lung metastasis, brain metastasis, and primary tumor in situ. So it was, he told us that he didn't put too much stock in stage 1 through stage 4, but if it was diagnosed by a typical oncologist, it would have been stage 4. Wow. So in his opinion, the surgery would have made things significantly worse without treatment first, because I was given a very low chance for being cured. As far as I'm aware, it was somewhat in the range of 30%. Wow. So yeah, his plan was to do chemotherapy first in, I believe, 4 treatment rounds of 1 week, and then go into the orchiectomy once the tumor had shrunk.
Okay, so you were treated with VIP, right? So that's ifosfamide, etoposide, and cisplatin, I believe.
Yes.
And what did you have any effects from those?
Biggest effects from those, as you would expect, are not nausea, but something that I don't think that many people appreciate about chemotherapy is some of the minor details. Most people focus on the nausea, which is absolutely a very unpleasant feeling, but it is largely relegated to the treatment itself. So when you're being treated is when it's at its worst. For the most part, you're okay outside of it. So I was an inpatient for a 1-week treatment. So that meant that I came in, I believe, on the Monday morning, and then I was discharged on Friday afternoons. So it was 5 days of continuous treatment. And from the moment that the first IV went in, it never came out until the end of the 5th day. So I believe we had a 7-step rotation of chemotherapy drugs. I do have them here, but it's sort of buried in these documents. I'll see if I can find them. But so on the first day, we would start with 1 drug, and then it goes into the 7th, and then it would be saline overnight. So you're constantly having liquids being pushed through you. Mm-hmm. So it messes with your ability to sleep as well. So I had the worst sleep while being an inpatient. So you're constantly getting up and going to the washroom because saline, of course, is mostly fluid. So your bladder is becoming full. It messes with your taste buds, it messes with your sense of smell. I can't speak for people who are, say, outpatients who are doing radiation or daily treatments, for example, but I expect that maybe they could have experienced more minor variations of these symptoms. But if you're an inpatient, you just need to be prepared that you will be experiencing these sort of things. The nausea will subside overnight for the most part, and then it will come back in the morning, basically, once you're back on the regular schedule.
Gotcha. Okay. So you were in the hospital for a week, and then between, were you living your normal life, like going to school, or you were on pause? And how did you kind of spend your time between rounds of chemo?
Yeah, so I've heard stories about people who will continue to work or be students between their chemotherapy sessions. I don't. If I'd forced myself, maybe I could have, but I would have spent a week basically. Okay, so the cycle was 1 week of treatment, 2 weeks rest, and usually that first week on that break was spent sleeping, resting, because these symptoms do carry over for at least a few days after, and it does drain you of your energy quite a bit and your motivation to really do anything. So I would say that outpatients or people doing radiation might have a better chance of maintaining a normal life. But my personal experience, my mother and I, we rented basically what would have been a bed and breakfast place for the year. And we mostly spent our time together. I would spend about 4 days to a week or so just getting my energy back. And then we'd spend the second week together doing things. We'd usually go to movies, go sightseeing. My mother loves the West Coast. She's not a fan of the weather in the East Coast, the snow and the rain out there and the cold weather. Mm-hmm. So she basically treated this year almost like a vacation in a way, because she loves the West Coast climate.
Yeah. So after chemo, like, did you have more scans and it still revealed that you had, the lymph nodes in your lungs, and you mentioned your brain too. What was the course of action on that?
So after the 4 rounds of chemotherapy, that would be around, I believe my last treatment date was like the last couple of weeks of April 2014. So I was diagnosed January 2014. So it took approximately 4 months to get through the treatment cycles. At that point, we basically had to wait for, again, the Canadian healthcare system to allow us a surgical room for the orchiectomy. And during that time, we had a number of different tests. We would run MRIs, CT scans every once in a while just to see how things were going. And thankfully, my body was responding extremely well to the chemotherapy. It was very effective. The metastasis on the brain, as far as I'm aware, actually receded. And since the last MRI that I had, I believe it was 2 years ago, there was no sign of it. So that very uneventfully went away on its own. The lungs were the major point of contention. That would need its own surgery in order to remedy those. But basically, from April, and we waited approximately June. I believe it was July or August. June or July was the orchiectomy. And again, a little bit uneventful. The surgery went completely according to plan. We actually went back to the campus university where I was first diagnosed in their emergency room, and they performed the orchiectomy, and it went off without a hitch.
Nice. And then, so the lung stuff you said was still the point of contention. So what was the treatment plan for that?
So, the lungs being as buried as they are within the chest, you can't, as far as I know, you cannot biopsy the lung tissue without doing a full surgery. Lymph nodes are close enough to the surface where they can be biopsied. But in the case of the lungs, Their imaging showed lesions on the lungs, and their interpretation of it is that they could be cancerous. They could be cancerous tumors or lesions. So their course of action was to perform a surgery on each lung individually in order to take out as many of the lesions as they could find. So following the orchiectomy, I believe it was another 2 months. So early September, I believe, was the first lung surgery. That was performed at the General Hospital. And I spent about a week, I believe it was 2 weeks recovering from that. And then after about a month after that, we got the results and they came back as negative. So those, as far as we were aware, all the lesions on the lung were just scar tissue. So whatever was growing there during when the cancer was at its peak had been reversed by the chemotherapy treatment. Following that, just because there was no cancer found on one side, I was given the choice as to whether or not to do a second surgery on the right, because cancer doesn't discriminate whether or not it's in the left lung or the right lung. So if they didn't find cancer on one side, it's far less likely that they would find it on the other. But their recommendation was just to be cautious and to take it out. And so the thoracic surgeon that I had told me that if it was my son, I would pressure him, basically peer pressure him into doing the second surgery in order to be absolutely certain. So it was in early December of 2014. We did the second surgery. I bounced back a bit faster. I only spent, I think, a week, I think it was 5 days actually for the second surgery in the step down unit. And I was discharged.
So I read in the story that your mom put, which you said she may have dramatized, but that you had at one point had a chest tube and was draining fluid from your lungs. Was that before or after the lung surgery?
So I had a total of three chest tubes. The very first one would be situated just after I started chemotherapy. So I might have skipped over this a little bit. So when I moved from the campus university after my incident in the classroom, and I was moved to the city hospital, Coleman's takes me out of the hospital to the cancer agency. We immediately start chemotherapy. I believe it was the same day that I was moved. And that happens for, I believe, 2 days. So my mother arrives the day after I was moved. So she immediately got a flight the same day, came over. So we do 2 days of chemotherapy, feeling pretty decent. I remember thinking to myself, no, maybe I'm not going to be one of those people who can resist the effects and not throw up during chemotherapy. And so night of the second day, according to her, I wake up screaming, saying that I can't breathe. I'm having difficulty breathing. Doctors come in. They can't figure out what's wrong just by looking at me. So we go for, I believe it was an MRI at the time. And they find out that there are shadows on my lungs, which they recognize as high likelihood is fluid. So the lesions in my lungs are leaking blood into the pleural cavity, which is the area around the lung, basically just outside of the lungs. So I have blood exerting pressure on my lungs, which is preventing and limiting my breathing. So basically they stop chemotherapy at that point and cart me back over to the general hospital across the street. And didn't really tell me a whole lot. They were actually, I can't quite remember what they were planning on doing. I think they were planning on maybe another procedure through my back or something, but that was sort of derailed by the being unable to breathe. So we go to the emergency room of the general hospital and we insert a chest tube. So Is how common are chest tubes when it comes to cancer treatments? Do you know anything about that, or have you heard anything?
Not very common in my experience of talking to people. I know a couple people who have had lung surgeries, and I believe they've had them, but for the most part, I don't think they're as common, at least for this diagnosis.
Yeah. So if anything, if the cancer has anything to do with the lungs, there's a chance that they will be bleeding. So naturally you'd get fluid buildup in the chest, which is what a chest tube is meant to remedy. So the bleeding of the lungs is called a hemothorax. So the chest tube goes in again, right around the center of the torso, approximately. So in the emergency room, they took a scalpel, cut a hole in the side of your chest with worryingly minimal anesthetic. It's a very safe procedure, but basically they freeze the area, take a scalpel, and cut a hole in there. They must have told me what they were doing ahead of time, but again, I was probably not thinking straight, and I was taken a bit off guard by it. But the best way I can describe the procedure, I thought of this analogy at the time, or this metaphor at the time, but the way I describe the feeling of it is if somebody takes those old pencils and rubber erasers at the tip, mm-hmm. back from the 90s. I'm not sure if they probably don't make pencils with erasers on the end anymore, but imagine one maybe 5 times that size, or 5 times that diameter, and they're just shoving it into your side and they're rotating it basically. And it feels like a very strong amount of friction being like shoved into your side and rotated. And that's them cutting into your side while you're still awake and under anesthetic. So they take that tube, this rubber tube that's attached, the other end is in a bucket, and they put that into the hole, and they stitch the rubber hose to the skin around that area, and then they bandage it in order to seal the pressure, basically. And so the difference in pressure will actually force whatever liquid is in your pleural cavity into the bucket, more or less.
Wow.
I'm probably missing a couple of steps. I believe there was some equipment as well, like some monitoring equipment that might have been used in order to mess with that pressure difference in order to draw the fluid out in some way. But it does take days actually in order for this to happen, because it has to be done by gravity. It's not done by applying suction to it. So this was done over the course of, I think, a week in January.
Wow.
And once that's finished, they will cut the sutures around the tubing, and then basically the nurse will have their hand on the tube. They'll ask you to take a deep breath in, and then very slowly sort of hum and let air out in order to create a positive air pressure in your chest, so they can pull the tube out and cover it. Because if there was a negative pressure there, then I believe your chest would potentially could collapse.
Oh my gosh.
From negative air pressure going in. So you're pushing air out in order to keep that pressure difference from the inside of your chest to the outside, more or less. And then they'll take that opportunity to seal it and stitch the skin together and bandage over it.
That's crazy. Yep. Science and medicine are crazy, aren't they?
Yeah. So I had 3 of those. So like I said, any cancer that deals with the lungs, you're probably going to have a chest tube at some point. So I had one when they were initially bleeding from the lesions, and then one after every lung surgery, because naturally, if you cut into the lungs, they're going to start bleeding.
Yeah. I know that there was another note that I read in your mom's post, and it might have been in your submission too, but there was a doctor that kind of later in your story had given you kind of a bad prognosis, but he didn't have all the details.
Yeah, this would be completely anecdotal. So this was just my circumstance here. As far as I'm aware, it was just some miscommunication. So this would have been just before my first lung surgery. So I mentioned the doctor who said he would peer pressure his son into having the second surgery. Again, this entire ordeal, I was extremely lucky to have the doctors that I did. I think I said the estimate was approximately 30% success. I'd say that my doctors were probably the reason why I succeeded, because their judgment was just so sound that they chose the best course of action. So I had one of BC's best thoracic surgeons. He was recommended to me by Dr. Koensberger. So this is a Dr. Yi. He was also the one who gave me this news that you're talking about. So before the first lung surgery, we go to a consultation with him. And this was our first time meeting. He only knows me through my records. So he pulls up my records during our meeting. He says, okay, this is what we're going to do. And then I believe he says, we talk about the general success of the surgery. And he mentions that in his professional opinion, that I would have, if the surgery was a success, it would give me a 1 year to 5 years to live, basically, given what he understands about my current medical situation. But this apparently happened at the end of the day, but I'm still amazed that I don't remember this event. It's been completely blocked from my mind, maybe because I was just so shocked that day hearing that I was going to die. But at the end of that day, we get a message from Dr. Koensberger's office apologizing that they had apparently, or rather, when I say they, I mean Dr. Yi did not receive my updated medical report. So what he was drawing from in his diagnosis was my medical charts back from in January when the cancer was first diagnosed. So to him, he thought that between January and I believe it was early September that we were talking with him, that the chemotherapy had done nothing, basically.
Okay.
So in his medical opinion, he thought he's not responding. Cancer's still there. He has not good chances, basically. So it was a shock. At the time I spent about, that was like 8 a.m. in the morning. So I spent between 8 a.m. and about 6 p.m. with that weighing on my mind.
Jeez. Now, what was that like? You'd say weighing on your mind. Like, what was that like?
I went for a walk, 9 a.m. or so that morning. I actually had to, I think I called my father actually as well and had to tell him. But again, I'm amazed that I don't remember this all that well, but I do remember, again, calling him and telling him what was going on. And we went home, spoke with my mom for a bit, and then I just went for a walk around the neighborhood, basically. Probably didn't think of too much that day, just kind of shocked.
Yeah, definitely like the trauma of it can kind of cause a memory blockage. So no worries on that. So you mentioned, I think earlier, that you're nearly 10 years out. So that's amazing. I mean, even though this doctor errantly gave you the 1 to 5 years, I mean, how does it feel to now be nearly 10 years out from this rocky road?
It's not something that I try not to weigh myself down with it. I try not to let it be something that defines me. I think I do take the opportunity to tell people when it becomes relevant. So I recently changed job positions at the company that I work with. So of course I get new coworkers. So just trying to make small talk. We talk about my history, and of course, when you describe what you've been doing for a number of years, you've got to mention that, I took a year off for medical reasons. And then some people will say, okay, you mentioned medical reasons. What happened? So it just comes up. But I try not to mention it outright. I'll usually just kind of say that, yeah, I had some serious medical issues that basically just took a year off of my calendar. But how I think about it after 10 years, I'm just thinking back on it. I just feel just how amazingly lucky I was, I think, to have the doctors that I did, and to receive the medical advice that I did, and also to have a parent and someone there for the entire year, because I know a lot of people go through this without any proper support.
Yeah, and obviously at this point you can't go back and change anything. I mean, it is what it is. You're seemingly healthy now, but is there anything that you wish you knew, like when you first noticed on that day after the bike ride? Like, is there anything you wish you knew that day that would have maybe changed the way you handled kind of waiting?
Mm-hmm. Um, not anything that I want to know, because again, back then I knew that that was a possibility. The reason that I didn't immediately go to the hospital and maybe go through like radiation treatment, because this was 6 to 7 months, I think, before the proper diagnosis. So it could have been handled by radiation treatment at that point. It wasn't it wasn't because of ignorance or anything. It was or ignorance or lack of knowledge. It was just not being able to admit to myself that this could be cancerous. What I would want to have known probably would have been what, I guess, hearing a story from someone else about what sort of impacts this would have on my life going forward. So 2 lung surgeries. You take out any lung tissue. It's going to impact your stamina significantly. The lungs are flexible to a point, and I think that with enough time and with enough training, I've heard stories about people who can do strenuous physical activities with as low as 1 lung, like a single lung. But in my case, I'm 6'4", 6'5". I'm a very large, very broad person. So that in itself means that I need more stamina. But if I could talk to myself back then, I would convince myself, I would detail, your life is going to turn into, you will walk for 2 kilometers and you will feel like you've walked 10, basically. The way I would have described it to myself would have been, imagine if you, with enough exertion, you feel like you're drowning, but you're nowhere near water, basically. Because back when I was first released from, I think it was my second lung surgery, was when I really started to feel it. The hospital that the surgery was in and the bed and breakfast where we were living is only a 1 block walk. So that walk plus going up the stairs to the second floor, I had to stop, I think, twice going up 1 floor on the stairs in order to stop myself from, because I was breathing so heavily, I could not get enough oxygen to myself. This was literally 1 week after my surgery. And just over time, lungs have adapted, but still it's nowhere near where I could be right now. So that's the sort of thing that I would tell myself, and as long as I would have believed myself, and if I could have talked to myself in the future, then I would have gone to the hospital and had it checked out immediately.
Yeah, and no blame at all, because I think, I was the same way. I waited, and there's lots of guys who wait, so that's just kind of what we do. But I think the point of like this podcast is to, if anybody's listening and they feel that lump and they're doing their internet search and they come across this, that's why I asked, because then maybe they could go get seen earlier. So I appreciate you sharing that. And your lungs, you said that, is it now that you walk 2 kilometers and you feel like you walk 10, or was that back then?
I don't really do any really massively physical work, as in I don't jog or anything. I tend to prefer uh, exercise like weightlifting, that sort of thing. Cardio isn't as high on my to-do list, but I was actually in fairly good shape in my previous job. I worked a very physically strenuous job at an airport, and I got into very, very good shape, and I was cycling. So my current shape is not quite that. I work in a laboratory, so I have far less physical exertion, that sort of thing. So it's at its peak. I would say I lived a very normal life where I could do heavy cardio. But again, it is just, I can't, you make no mistake. I'm never going to be at the same level that I would be if I had never had those surgeries, basically. And I think telling someone the consequences and accurately describing them and convincing them is what will get them to actually do something.
Yeah.
I would say if I really couldn't convince somebody, but they would let me sort of like physically interact with them, I would probably have them lie down. I would put my hand on their chest and hold it and basically apply pressure there and ask them, can you breathe easily? And have them describe that to me. And that would possibly give them some idea. But again, it's going to be hard to describe unless someone experiences these symptoms. Then you really can't tell how they're going to react.
Yeah.
Or how they will respond.
Is there anything else that you want to share that I have not asked about?
Not really, but I did want to emphasize that I mentioned that the doctors were one of the primary reasons why I think I succeeded so well. But I know not everyone's going to have this option, but having someone to be there with you, especially if you're going through a very heavily intensive chemotherapy treatment, it does affect your thinking as well. They call it chemo brain. You've probably heard that. You've had cancer yourself, right?
Yes.
So the way I describe it to people is that during the height of treatment, it sort of, and for probably a couple of weeks after, it sort of feels like someone is tickling your brain with a feather in a way, is the sort of feeling that you get. Mm-hmm. But having someone there, like these mentioned notes, my mother, like this amount of paper covers like correspondence between my mother and family friends and such. Like this was her project basically during my treatment, was to keep everyone up to date. And this sort of thing I could never do myself. I would never, if I was doing this myself, I wouldn't have the energy or the cognitive ability really to write like pages upon pages of information. I wouldn't, if I was in a meeting with a doctor, I would not write down words or concepts that could come up later, or numbers like tracking how my platelets were, if they were high or were they low, how, like what sort of symptoms are there to high or low platelets, for example. So just having someone there, family, friends, like up to a stranger, I suppose it's invaluable.
Yeah. And your mom is a board member of the Testicular Cancer Awareness Foundation, and everybody on the board is so grateful for her. Alex, thank you so much for being on It Takes Balls. I really appreciate your time.
Thanks. It was great talking with you.
For more information and resources for your testicular cancer journey, visit testicularcancerawarenessfoundation.org. You can also follow us on social media at Testis Cancer. We're on Facebook at Testicular Cancer Awareness Foundation.